We are being joined right now by CDC Director Rochelle Walensky. Dr. Walensky, talking about COVID-19 here in Nevada and Las Vegas. Thanks for joining us this morning.
Thanks so much for having me.
Our first question, the White House has declared us as a COVID hotspot. How concerned is the CDC about the situation here in Clark County, especially Las Vegas?
What we've seen in Clark County over the past 7 days is that cases are up about 47%, hospitalizations are up 21%, and deaths are up 18% just in the last week. So we are very concerned, and we want to put all of our best efforts forward to decrease transmission and to get people vaccinated.
Are those numbers noticeably or significantly higher than other parts of the country that are tourism centers?
Absolutely. What we're seeing is that as we anticipated, this virus is an opportunist, and it goes in places where people are less vaccinated. And Clark County happens to be one of them, with only about 40% of people in Clark County fully vaccinated. So in areas of the country where we have higher rates of vaccination, there has been more control over disease transmission.
So all that's naturally going to prompt the question, should masks be mandated again?
That's going to be a local jurisdictional question and policy. But what I will say is individuals really do need to protect themselves regardless of the policy. We know how to protect yourself. We know that you can get vaccinated, fully vaccinated. And unless you are fully vaccinated, the absolute best way to protect yourself is to continue to wear a mask.
I know this might just be an educated guess on your part by now, but how close are we to going back to a remote working, social distancing, quarantining situation?
That is really going to depend on the critical behaviors of this pivotal moment. If people start working towards getting more and more people vaccinated, decreasing disease transmission by wearing the masks and doing the mitigation strategies that are necessary, I think we can avoid that situation. But with this Delta variant more transmissible, we really do need to be vigilant just at this period of time.
What is most concerning to you about this recent surge in cases? Is it the variants?
Certainly, the variants are more transmissible, 2 to 3 times transmissible as the initial wild type virus that we had about a year ago. Watching the cases rise, the fact that people are not taking the mitigation strategies that they need to, I know as we see hospitalizations rise that ultimately could mean more deaths in the future. And quite honestly, right now, with 3 vaccines available to us now, available to everyone above the age of 12. These are preventable, and that's really what's most disturbing to me now.
We hear a lot about Delta. What about Lambda? Is that still spreading and growing?
What we know is that these viruses tend to take hold when they are most transmissible, and Delta right now is the most transmissible variant that we have seen, and so that's the one that's really taking hold right now, and we're watching carefully.
And finally, kind of a touchy subject, your message to those who are afraid or simply refuse for whatever reason to be vaccinated.
My message would be go talk to your pharmacist, go talk to your physician, go talk to your local health worker, your public health worker, and get information. Because what we're not here to do, we don't want to convince you to get vaccinated. What we want to convince you to do is go talk to people who are informed in these areas and ask your questions. Because I believe that when you get those questions answered, you really do understand the risks of COVID, and you understand the benefits of vaccination, and you understand how safe these vaccines are, with over 160 million Americans already vaccinated, that you would make the right informed decision, the informed decision that would keep you safe and to get vaccinated.
Makes sense. CDC Director Dr. Rochelle Walensky, thank you so much for your time this morning and your answers.